A lot of times a child will do things without thinking, and when they get in trouble, all of a sudden they realize, oh my gosh, I shouldn't have done this. Child with ADHD has problems. The basic underlying problem is impulse control. They do things without thinking it through. This causes them problems with remaining focused, completing tasks, staying out of trouble sometimes. They do behaviors that will get them into trouble. They argue. They're struggling to get these different tasks completed, and they're frustrated because they're unable to do that, and they make careless mistakes. And so we see the child that is having also trouble with social skills, having trouble getting along with their peers. The best intervention for ADHD has been medication. Because it is a neurobiological disorder, the medication assists in helping the child's brain put on the brakes, in a sense of the word. Parent training is also important to help the parents learn discipline, because the child has to have a structured and organized environment. And also at school, they may need accommodations to help them to get through the classwork in an appropriate amount of time. The medication effects from several years ago, we would see children that were lethargic or a change of personality, and the parents didn't realize you need to tell the doctor that so he can change the medication. So the medication today is much more refined in a sense. The delivery system is much better, so we don't see this lethargic behavior or a change of personality. That's a sign of a reaction to the medicine, and it needs to be changed to a different one. All the different medications are a different chemical makeup, so just because one might be causing side effects, it doesn't mean the others will. The only side effect you should see with the medication is appetite suppression. It is a stimulant that causes the appetite to diminish while they're on the medicine. The medicine usually lasts anywhere, depending on the type, from 4 hours to maybe 10 or 12 hours. The other symptoms people talk about, like they're lethargic or their personality changes, these are reactions to the medicine and are unacceptable. You need to tell the doctor he'll switch to a different medication, because they're all different chemical makeups. But the biggest thing is the appetite suppression. Sometimes with some of the kids, depending on their intellectual level, we can do some behavior management, but that only lasts for a period of time where they just can't manage themselves well. Some people talk about diet, other therapies, but basically it boils down to again a neurobiological disorder and has to be treated with medication, and behavior management would also be advantageous. We do a comprehensive evaluation. Now, some organizations, such as the insurance companies, do not feel that a complete evaluation is necessary. But we have to make sure the child isn't low functioning, because those symptoms will be similar. We want to see where they're having difficulty or having a learning disorder. We want to see how they perform in a one-on-one situation. And we also gather information from the schools and the parents when the child is involved in a group to see what's going on. So we're looking at a list of symptoms and seeing how they perform. Their grades might drop a little bit, which is due to poor performance, not poor learning. The supports that we want from the school, unless the child is low functioning, is a Section 504 plan, which is a regular education program that provides accommodations, such as more time to complete work, written assignments, a syllabus in a sense of the word to help them stay organized. It is not where they're needing remedial help like in reading or math. It's a matter of accommodating them. And fortunately, even the colleges are realizing this, and they're providing accommodations. But a Section 504 is regular ed An IEP is special education. Now, if they're having learning problems or they're lower functioning, then an IEP may be helpful. ADHD has a lot of lookalikes. That's why we have to do a comprehensive evaluation. Reading disability shows similar symptoms to ADHD. Anxiety shows similar symptoms, as well as depression. So it's not unusual when a child is diagnosed with ADHD that anxiety follows along with that. Once we treat the ADHD, the anxiety diminishes. However, we can have two separate diagnoses where the child is anxious but also has ADHD. And so we treat the ADHD, and usually with anxiety we recommend therapy, not so much medication. Some experts believe that poor parenting may cause ADHD. That's not true. Treatment may not be as effective, but we use parent training to help the parents understand how to provide appropriate behavior interventions and discipline to be successful. It is, again, a neurobiological disorder. It does not become affected by poor parenting. Children that are trying to stay focused, we see this hyperactivity. Actually, their hyperactivity is their ineffective way of staying focused, but the brain is not allowing them to. So you can't just tell them, be more focused, pay attention. They're desperately trying to, but they're not successful. The different foods and things that we say may cause some problems with children, that's only if they're allergic to it. Not every child is allergic to sugar. For example, if a child's eating candy or drinking soft drinks, they may do just fine. Other children smell the sugar and they're bouncing off the walls. But that does not cause ADHD. It can exacerbate their behaviors because they're allergic to these different food items, the dyes, the sugar, other foods that they may be allergic to that other people aren't. With the different tablets and technology that we have, this blue screen causes problems for the child because they're not able to rest. And it stimulates the brain. Even though their eyes might get tired and they might, what we think, are dozing off, their brain is still spinning. It is very important that we limit the amount of time on these screens. And new research is coming out that's showing there is a significant problem with children being on tablets and other technology items that have screens for several hours in a day. Usually if the child can't sit for long periods of time and stay focused on something that is not so stimulating, people will say, well, some of the symptoms they see with kids playing games, well, he can sit and stay focused with a game. Well, that's because it's stimulating. Can he sit and read a book? Can he complete tasks? That's what we want to look at. Also, does he make careless mistakes in his work? He's trying to do an assignment and he knows how to do it, but he makes careless mistakes, or it takes him an extremely long time to finish tasks. Also, they tend to be very talkative. They have trouble, they're fidgety and restless, they can't sit in the seat, they may get up and move around, always in motion, things like that. They also are very unorganized. They can't get their act together and they forget things all the time. Those are some of the symptoms we see, and distractibility is a big one, but the underlying symptom we see is poor impulse control. Children with ADHD struggle with school because it's so difficult. They don't have a lot of freedom to make their own decisions. I mean, we can't let them because they would get into a lot of trouble. But as an adult, they become very, very focused on their work. Anything that's stimulating to the person with ADHD, they will really focus on it and almost become a workaholic where you have to really pull them away from it. So we even see these kids that go into the military, they excel without medication. So if it's something that's interesting and stimulating, which if we would hope their career is, they do extremely well.